Vice Chair Ryer moves. Would you like to move your bill?
Yes, thank you, Mr. Chair.
To be placed on the general register, Vice Chair Ryer moves that House File 3978 be recommended to be referred to and placed on the general register. Vice Chair Ryer, to your bill.
Thank you, Chair Bierman, Chair Backer, and members. House File 3978 is an entirely technical bill. It cleans up legislation that passed last year that established a provider wellness program that was aimed at addressing healthcare worker burnout and increased rates of mental health concerns among our healthcare providers. It alters language about a provider wellness program established in House File 1645. It changes the eligibility from just targeting physicians to targeting all healthcare providers. The wellness program could include offerings such as peer-to-peer counseling and mental health services. And this bill extends eligibility and associated confidentiality protections for those who participate in that program to include all healthcare providers. As established last year, it includes only physicians. This initiative is led by the Minnesota Medical Association, which works collaboratively with other care providers and their organizations in the shared goal to reduce rates of provider burnout and associated implications on the healthcare workforce in the state. This is a good program targeted to the needs of our care providers. And to any members of the public who may be struggling, 988 offers 24/7 judgment-free support for mental health, substance use, and more. Text, call, or chat 988. Thank you.
Thank you, Vice Chair Ryer. We do not have any testifiers. Any members of the public wishing to testify to this bill? I'll just note that there is an issue briefing from the Minnesota Medical Association describing the rationale for allowing this program to serve all healthcare professionals, not just physicians. Members, any discussion to the bill? Representative Nadeau.
Thank you, Chair Bierman and Representative Ryer. Can you tell me a little bit about, so I work for a company that has insurance and there's a wellness program. So this one's in statute and it's specifically for statewide associations exempt from taxation. Is there something specific? What am I missing here? I mean, we're going to talk about MCOs in a little bit here, and there's quite a bit of money that's spent on wellness, and I don't have any problem with adding healthcare worker to the physicians. I'm just curious why we're doing it.
Vice Chair Ryer.
Thank you, Mr. Chair. Thank you, Rep. Nadeau, Vice Chair Nadeau. To me, it's a matter of looking at workforce. We have any number of workforce programs. We do things to support workers in a number of fields and disciplines. We know that we're losing healthcare providers from the field because of the burnout, the stress, increasing mental health issues, and so providing support that the Minnesota Medical Association, in collaboration with a dozen other groups, can put together and to serve their members seems to me to be a good investment in protecting our healthcare workforce.
Representative Nadeau.
Thank you, and thank you, Representative Ryer. So this would be, so these are dues, insurance, components that are paid for by these professional associations. Part of their insurance is they're aligning them. I still don't. I think it's a good idea. I just still don't understand if it's redundant, if it's new, we're hitting more people.
Vice Chair Ryer.
Thank you, Mr. Chair. Vice Chair Nadeau. I see. This is more of a communication, taking out the barriers, helping people understand what resources are available. It's not providing coverage for more mental health. And I'll let my friends correct me if I'm wrong. Oh, in fact, I can phone a friend.
Would you please introduce yourself to the committee and proceed?
Thank you, Chair. Chad Fang from the Minnesota Medical Association. As mentioned, this is separate. This has nothing to do with insurance. This is a separate program that was funded last year, separate initiative that offers things like peer-to-peer counseling and potential mental health services. Right now it's targeted towards just physicians. This would expand, especially those confidentiality protections, to all healthcare professionals. So,
thank you.
Separate.
Representative Nadeau.
Thank you. Now we're getting somewhere. I appreciate it.
You bet.
Okay, so is that an ongoing funding source? Was it one-time dollars? And there's just dollars that haven't been spent so that we're increasing access to it?
Mr. Fanning.
Thank you, Mr. Chair. Representative, that was one-time spending from last year.
Representative Nadeau.
And so what was the appropriation?
I can-
Mr. Fanning.
Thank you, Mr. Chair. $250,000 last year.
Okay, thank you.
Thank you, Representative Nadeau. Representative Backer, or Co-Chair Backer.
Either work. Thank you, Chair. Question is, are there any triggers that would require disclosure to the licensing board? Or is this totally shield if somebody comes in and they have challenges? How is that handled to the licensing board?
Mr. Fanning.
Thank you, Mr. Chair. I don't know. I can get back to you, but right now I do not believe that report to the licensing board.
Follow up?
No, I would appreciate that follow-up because that's important because I know Vice Chair Ryer understand what you're trying to do. I think the easiest way, but of course there's costs, is getting more people into the workplace so we can lower the stress load and so forth. So I think that would, even though I see where you're going with this, I think that would be a better focus on getting more people in the profession so we can limit the load. I would like to see that somehow, but I would like to know the triggering. You know, does that hurt? Because obviously if we have a wellness program, people feel if they say something, it gets triggered, then we don't get our end in mind. So thank you. That's it.
That's it? All right. Representative Van Binsbergen.
Thank you, Mr. Chair. A quick question about funding. So just point of clarification. So we appropriated $250,000 last year, correct? And we're expanding the program to.
Mr. Fanning. Mr. Fanning.
Thank you, Mr. Chair. There is no new money in this bill.
I realize, but there's no new money, but we're going to add more people to the wellness program, right? So, and that can be done without any extra dollars going in?
Mr. Fanning.
I appreciate that. The intent of last year's bill was to expand this to all providers, but it was written for just physicians. So the intent of the $250,000 was for all healthcare professionals last year.
Follow up, Mr.
No,
Representative?
Thank you.
Okay, seeing no more members. Let's see, closing comments, Representative Ryer.
Thank you, Mr. Chair. Thanks for the discussion, everyone. I'm eager to see this move forward. I'm pleased to see it broaden out to reach the original intent of covering all our healthcare providers who do so much for us. Thank you.
Thank you. Vice Chair Ryer renews her motion that House File 3978 be referred to the Ways and the General Register, apologies. The General Register, all those in favor say aye. Aye. Those opposed?
No.
And the motion prevails, and 3978 is recommended to be placed on the
We get a roll
General
call?
Register. You want a division?
Yep.
Hands? So those in favor, please raise your hands for aye. And you got to get a count.
Really?
The ayes have it. Do we need to do a count? I think the ayes have it. We should be good. Motion prevails, and House File 3978 is recommended to be placed on the General Register as amended. Thank you, Vice Chair Iyer.